Why did I choose gastroenterology? I think it's the perfect blend between the medicine side and the procedural side of things. I loved internal medicine. I loved getting a chance to speak and connect with the patients and kind of play detective and try to figure out, what their body is telling, because every person says a story through their symptoms, their illnesses, and not only that, but also be able to intervene and provide therapy on whatever it is that ails them. I'm board certified in gastroenterology, so I provide services from everything from the esophagus down, the liver. The biliary tree, if you imagine, is kind of a glorified plumbing system that runs through the liver. And as with any plumbing system, sometimes it can become blocked. So we provide services to help essentially unclog the blocking, be it a stone or a mass. We relieve the obstruction. For the pancreas, for example, we provide diagnostic services to figure out what lesion is in the pancreas and how to appropriately guide therapy. My philosophy of care is it's all about the patients. No two patients are ever the same. Sometimes the disease process is not the same, so you really need to provide individualized therapy. You need to listen to the patients, listen to what they're coming in complaining of, and providing the best care, treating them like this was your own family member, and ensuring that it's patient-centered and it's also a partnership between the doctor and the patient. One of the reasons why I love and went into interventional gastroenterology is that everything is constantly evolving. What we do now is not necessarily what we'll be doing in 5-10 years. Everything is trending towards minimally invasive approach. So what we used to do 10-15 years ago that would require surgery, which obviously increases the morbidity and mortality in patients, particularly patients who may be very sick, now we can do these procedures endoscopically. So it's fascinating. It's a field that is just constantly growing, and I'm excited to see what the future holds for the next couple of years. Colorectal cancer screening via colonoscopy is one of the greatest tools we have for cancer detection and elimination. So if you find a polyp and you remove the polyp, you essentially eliminate the risk of cancer. It's minimally invasive, and now we have tools that we can use for larger polyps or more complex polyps where we're still able to remove it endoscopically, so patients do not require surgery. Patients get the colonoscopy, they wake up and they can go about their lives. So I think it's a wonderful tool, especially when we have seen a growing incidence of patients on the younger side with colorectal cancer. I think in terms of patients feeling scared or intimidated when they go see a doctor, I've lived through both sides of the coin, and I know how scary it can be. So I really do like to try to relate to them on a personal level. If there's a language that they feel more comfortable speaking, even if they speak a little bit of English, I try to connect on that level, even if it's through use of interpreter services. Personally, I speak Arabic. I'm North African in descent. My Arabic is a little bit choppy, but I can get by. And I also speak Spanish fluently. I trained in medical school overseas for part of the summer, and that really helped me hone in on my medical Spanish skills. It's not always about medically treating the patients. Something my mom said, you also treat their souls. And sometimes just being there, comforting them, helping them, guiding them through whatever stages they're going through, I think for me that's the most rewarding experience you can have as a human being.